back at the university, back at getting my DMSO today. And I have physical therapy right after this, so at 9:40 I got physical therapy, so there's a bunch of pre-op stuff today. I don't know what they're gonna do, but they gotta do a couple of things. So the surgery is June 6th, and that's it. One of the questions I get asked on Reddit is, how do the pudendal nerve blocks work? Well, they numb it, of course, in that right side. It's like the bicycle seat, so you can sit on a bicycle. That it numbs that area, and so especially on the right side, she always does it on the right. So it does work. Anything it works for 6 to 8 weeks. Really? I think so. So that is coming up on June 6th. My dad gets back from the Dominican Republic at the end of the month, so he should be able to take me, because we have to schedule it for June because he wasn't coming back until then. So pelvic floor physical therapy is for pelvic floor dysfunction, and it does work. Sorry about that. She came in. Yeah, they're always coming in. They got to do pre-op stuff after this, so, and then I got to rush over to physical therapy, which is on the other side of Coralville. Yeah. So the cornerstone for pelvic floor physical therapy is gabapentin and physical therapy. It does work. You just got to give it time. My physical therapy is like a slow tortoise. It seems like that we are just slowly moving along. And Kim is doing everything she possibly can. She's an amazing physical therapist. I don't think I would trust her with anybody else doing it but Kim. So it's always important to take out the bad distractions and have the good distractions. Good distractions are good, but I'll get into that here in a little bit. But with all this political stuff, and I hate it. I already know who I'm going to vote for, and so that's what it is. All that junk is just, yeah, it stresses me out. So gabapentin, they've upped it twice since I've been on it. I take 3 pills twice a day. No, 3 times a day. I take 3 pills 3 times a day for gabapentin, and then physical therapy once a week. And that's been going on for about 7 years. I used to get the pain blocks in the middle, but that was done through the pain management clinic, but I don't do that anymore. She just does it. It's easier. And then my neurosurgeon likes that better anyway, so that works best. DMSO is a bladder treatment. It works if you give it time. You have to give it time to work. You gotta have patience with this, because they're just gonna throw darts at the wall and hope something sticks. The good distraction. So I'll talk about that next time. This is it for this time. I got a message for somebody else after this, so I will let you go. But I'm telling you that for the pelvic floor, if the pelvic floor dysfunction works, or the physical therapy and the gabapentin work for the pelvic floor, and the DMSO treatment does work for the bladder. Plus, I have that coin in my ankle, which I'll show you as soon as I'm to get done with this. So I'll be right back. See? Okay. That is my scar from the surgery that she did. The Ecoin is right there. And then the other wolf paw. I'm not getting more wolf paws, so yeah. This is where I go to physical therapy. Up on that second floor, right there. Mercy Clinics.